Let's come to the next big point, because it's all about premium. So I have to go a little technical, because the audience of this video would be not about the cost, but about give me the best on earth. And of course, with a great price. Of course, we even have an EMI system. If somebody cannot afford a premium hair transplant but still want to do, we have an interest-free EMI system. Not to worry. Number three, especially those who are into films, models, whose face are being sold, influencer, podcaster, they have to do the best, they cannot compromise. Now, the next big thing which came from India, which is hilifying the world, and it is not possible everywhere because it requires big team. What's that? It's called Instant FUE. For that, we have a small poem, मछली जल की रानी है, हाथ लगाओ डर जाएगी, बाहर निकालो मर जाएगी. Means, if these hair grafts are like fish, I call it Dolphin FUE. Means what? Once I remove these hair grafts, these are organs, these are called blood circulation, they are connected to the blood vessels. Now, once we remove it, then keep it in whatever solution, its oxygenation is gone. It will start living like anaerobic, like aerobic exercise hota hai na, anaerobic exercise shuru ho gaya. Now it may die. Like if I cut the finger, long time it's outside, whatever solution, it may die. That's why you see heart transplant, liver transplant flying through drones or through ambulances from one destination or another, because time is critical. Similarly, there to there, suturing. Here I'm not suturing. We're just putting inside the holes. The hair follicles, we are just putting inside the holes over here. So once we take this hair follicle out, the newer research which came from India is, why don't you make the slits first? Okay, holes where all your plants are going to come, the hair follicles are going to come at the correct angle directions after checking few follicles, their length, their width. You check out few follicles, check their length, their width, and everything. Then you make perfect directions, angles of your slits ready made, so that when you come for implantation, there is no bleeding. Otherwise, when too much bleeding is there and you start implanting, not great results. The visibility is not there. So by the time you come and implant, it's gone. So, and the reperfusion has already started, because when we make slits, there's a ischemia, primary ischemia. Then the body comes to heal it, clots and everything, reperfusion. When we put the graft, it's a secondary ischemia. So these grafts, we take it, we put it. We take it, we put it. We take it, we put it. So three teams. One team is punching the graft out. Two teams come here, implant the graft out. Then they come here, punch the graft out. So punch out. Come in, implant out, puncture in. So three teams with three trolley, 10 plus people. So within 5-10 minutes, the grafts are taken from 37 degrees centigrade, your scalp, with its severe blood supply, and put it back. So it's back to the same temperature and it's ready to connect. Of course, it will take 2-3 days to connect, but why the hell I should keep the graft outside? Yes, it's not possible in America. Only one clinic is doing it in America. Nobody is doing it in UK. Nobody is doing it in Europe. Nobody in Turkey. Nobody in Dubai. In India, only 10 doctors. Because it started from India. Because it's a manpower dependent. You need so many people, 10, 12 people to do this. We also have to call our friends from outside to take part in it. And that time, we can only do one surgery. Second surgery is postponed. So this is the premium most, okay, where we're talking about, where we simultaneously extract and implant the grafts, okay. And in a little lesser one, maybe the graft is outside for 30 minutes, and even lesser one, it's for 1 hour, and even lesser one, maybe 2 hours. So our cost little depends on how much time the graft is outside the scalp. Accordingly, the manpower increases. Do we need 10 people to do the surgery, or 7, or 5, or 3? So that doesn't mean 3 won't give results, but somebody wants a premium for its, their graft is damaged, they have to pay for it. Because we're putting all the effort to simultaneously put it. Nothing put outside in no container. So this is the next big thing called Dolphin FUE. Dolphin FUE or Instant FUE reduce outside scalp time of the hair follicles, hair grafts, so that they get the blood supply, oxygen, nutrition immediately. Like a finger is cut, put it back fast, survival high. Like you got a stroke, golden hour. Get a heart attack, golden hour. Get an epilepsy, golden hour. Get a trauma, bleeding, golden hour. So they say in medical science, golden hour, the 1 hour to come to the doctor, emergency and get it done. Now hair follicle doesn't have 1 hour. They are sensitive. The metabolic rate is high. They are like chewy plant. They are like fish outside the water. So minimum time you give, better. That doesn't mean if they are outside at more time they won't survive. No, they have been surviving so many years. But the perfection is increased with technology. Don't let the ground be outside the scalp for long. So this was the premium hair transplant, another point. Next, see, once we make so many slits and we put the graft like this, so I'm not suturing them. So first, I want to make this fertile. So when the new grafts come, it's ready to receive like a farmer, like a soil. And I want to make these grafts stronger before I do the surgery. Okay. Next, I want to get rid of all the dandruff and also no disturbance, no boils, nothing. Okay. Now, when I put these grafts, we have FUE boosters, very unique. Not everybody has it. Called autologous exosomes, DMEM, ATP, lot of other stuff for great antioxidants. So our job is, if this is the blood vessels here, they dilate. So more blood circulation, more oxygenation. We even put oxygen while doing a transplant to so have good and extra supply. We have certain medications which will increase the circulation. We will never stop minoxidil. 90% we will stop it for the bleeding. We have something else to reduce the bleeding. We will never use adrenaline, which is vasoconstriction, reduce the bleeding. Right now, I want oxygenation, but everybody is bothered about the bleeding. So, for bleeding, interestingly, as you said, we have multiple branches. Cardiac surgeons help us out how to control bleeding without using adrenaline with continuous use of minoxidil. So that specialty helps it out. Wound healing, wound burn surgeons helped us out. So we are a believer working at a biochemical level, cellular level, molecular level. The biochemist, immunologist, molecular biologist has put out. We cannot have all the knowledge. So what we do is we surround ourselves with the best, okay, and take the best and applied knowledge. We just don't believe in information and knowledge. We believe in applied knowledge, knowledge which can create a transformation, knowledge which can be useful. So knowledge is not power. Applied knowledge is power, and practical knowledge is power after seeing the results. So you won't believe. We love it. We always excited. We are part of the team who created world's first hair follicle, as you can see here. My this hand, these two here are not mine. These two here are of a patient in 2012. So this is called allogenic hair transplant, somebody else here. So research is happening in Korea with a team because everybody thought they're going to be rejected. Of course, people who had got kidney transplants and all hair transplant is done because they were on immunosuppression. But you'll be shocked. There could be a possibility of putting somebody's hair. So research under progress. Okay. So we are research-based people, scientific papers, conferences, talking with the best doctors. Now it's no difficult. Just take a phone call and we are in touch with the top 30, 40 doctors on earth. And we keep exchanging. We believe in exchange of information. Nobody alone is perfect, We come up with new hypotheses, new anecdotal approaches. So a lot of things. We have used hyaluronic sprays to make it hydrated. Hyaluronic sprays for sensitive skin. People put spray after the surgery. We have advanced it. How to absorb water into the grafts. It's called HA spray, something unique to a clinic. Okay. People are worried about swelling after hair transplant. It's all about gravity. If you don't bend down, no swelling. Why do you use steroids and all? Make sure that you are 45-degree. So if see, for example, if you are at 45-degree, okay, so all the water will go like that, okay. But if you are bending in the front, like laptop, phones, eating, then water will come here. So all this water will come here to get swelling. But what we found is even we used to get swelling before, now hardly any, because we use gravity. So it's common sense. So science is fascinating. Keep working like a physicist. Okay, we are also experimental physicists, experimental academicians who first think what can change. Then we do with under ethics committee certain protocols, test it through, and then we introduce to our patients, which first we test for safety and everything. So touchwood, our team is one of the pioneers internationally to give newer approaches, newer technologies to the field of hair restoration in the world. We don't do blah blah about it because we love it and we keep it silent. So allogenic hair transplant from our clinic, first hair follicle as seen here, our team part of it. So now you're understanding your clinic, your captain should be part of research and development, futuristic sciences, keep thinking about improvement, how to reduce the pain. So we have called from Germany, even syringe needles finer than insulin syringe, 34 number. See, so that you don't have much pain in the premium category. We have fillers cannula to help us go so that we don't have to prick you so much. So every prick is important for us to give you comfort. So look, because it's not just anything, it's like nobody thought about 34 number needle to give you less pain. Okay, the great vibrators, the great eyes, the alprazolam and whatnot, the toilet anesthesia and much more. So here we look for your comfort. Okay, so this was a part of it. Now let's come to the next. Now, make sure that those who are taking up medications after the surgery, their hair transplant results will last. Those who are stopping, if you stop the medication suddenly, you will find sudden loss of hair. See, you do the brushing of the teeth for life. You take bath for life. If I do exercise, it's there. If I no exercise, it's not there. See, I have to put iron to this shirt, to the scrub. So every damn thing needs maintenance. We are on this earth as in the guest house called Earth, 0 to 80 years, 0 to 90 years, 0 to 70 years. So this is not permanent. This is just a guest house. There's nothing permanent. So don't think that you're taking 1 or 2 tablets or putting something on your head for a little longer. I'm sorry, this is not there is a price to pay for everything. You have to put that effort to put something here or take some tablet for long term. Only then you can make sure that your hair remains there, because it's important. My patient should have long lasting hair. It's not just get them a great density after few is gone. So I have seen those who continue medications, they retain longer. Some people just for marketing say whatever you want to listen, they will say, "Oh, don't use medicine, nothing will happen. Don't use that." See, if somebody has a side effect, will change this. A new medication just came 3 days back, which you can put it here. It will not go into the blood. So those side effects are gone, which you're afraid of, and are all gone because it's not going to get absorbed. Just 3 days back it's come. Okay, just 3 days back in the country it's come. So now that is a great game changer. Because see, if some fire is there with genetics, I have to stop it. I have to dove it off. Otherwise, I'm putting my graft and the fire is still damaging it. I have to give a lot of nutrition oxygen to the hair. Please understand, nobody is magician. You have to give something to get some great results. Don't get fooled off. Otherwise you're going to lose all the hair. So hair transplant is not permanent. Initially, it was thought that this is a permanent area, but post-COVID, we have seen dupa. People are having poor hair over hair also. People are thinning hair over hair also. Now, this is the same hair we are putting it there. Now, new scientific articles under our name is coming up, where we are selecting the perfect hair at the occipital region and putting it after the hairline, because those hair are there of your grandfather for life. So now my future patients with this new research from our clinic is find the best quality hair at the back, which your 80-year grandfather also has. So after the hairline, put that. Those hairs, also called with our clinic name anagen hairs, okay, they may last for life. May. So my patients at the front at least they may have long-term hair. So that was only after choosing those hairs which may last, not all hairs. So there is a very safe donor area, there is a limited source donor area. Within the safe donor area at the back, there is a very, very safe donor area also. So now I just put down a few thoughts for those who are looking for quality, who are looking for premium, who are looking for the best, not just for money. Because going into too much details, now number two, we do we do audit. Now when we are making slits, photograph is taken zoomed up so that our slit should be parallel to the existing hair. When you are making the holes, what depth should we go? So if 5 millimeter is my graft, I'll go 4.5 millimeter over here and 4 millimeter at 30. This is 20 degree, this 30 degree, 4 millimeter, and this 45 degree around 4 millimeter. So whether I'm going to the correct depth or not, we put something inside the holes. I check by putting something inside the holes, as you can see in the diagram, so that we know whatever holes we have made are in perfect angle or not. So every step is photographed and zoomed and shown to the person who's doing. Okay. Plus we have to keep a picture before the shaving, so we know where are we going to put the graft. What is the number of the grafts we're going to put. Plus I have to stop shock loss by not damaging the existing hair. Behind also, if I'm taking graft, if you are taking the graft here, if this graft is turned, I may break this graft, I may damage your existing graft. Nobody will know. You will have a shock loss. So we have to make sure we don't damage the surrounding graft while we are extracting this graft. When we are planting one graft, we should not damage this graft. What distance should be between the two grafts? What depth should be? The curls. I cannot have one graft here and a one graft here. I have to have graft here, not here. So now you're understanding every step need to be clicked, zoomed, and checked. How many grafts are we damaging? Okay, trimming of the graft is essential. See, if we don't trim the grafts, the beard, eyebrow, and temples in the front, cobblestoning can be seen as you see behind. raised structures. I should not put double graft or triple grafts in the front, pluggy look. Okay, then I should not put the graft too much down, otherwise there is pitting. So this is a microsurgery. Magnification you have to weigh. Okay, and you get tired wearing so much. So two, three people should work, then they should take rest. Then another two, three should work. So now you understand what is a premium hair transplant. Boosters, instant, angles, directions, curls, trimming of the grafts, prevention of cobblestoning, prevention of plugging, prevention of 2-3 follicles. So plus don't let it dry. Don't crush because stem cells are here. So we should not hold the graft like this here. Okay. Otherwise the stem cell can get crushed. The root is here. We should not crush the graft. Sometimes two grafts are here. One should not be lying outside. The graft when we putting should not bend. So there are minor details, my dear friend. So it is not the instruments alone, it is not the medicines alone, it is the controller of the surgery, the boss, the captain, who is responsible for everything. The pilot, of course, the machine is important in aeroplanes, but here they are not expensive. Everybody has it. The best doctors have it. It's the commitment, the passion, going for the details, taking time, having bigger team, giving people rest. So I hope you now understand. And at the end, the premium hair transplant, some people may charge 200, 300, 500 rupees graft. We offer three different types of premium hair transplant at 50 rupees graft, 75 rupees graft, and 100 rupees graft. The same surgeries the top surgeons may offer for 100, 200, and 300 or 500 in India or abroad. But we are quite happy with 50, 75, and 100 to offer you premier hair transplant at Arjun. Hope you like the video. Right now, you can WhatsApp your front photo, top photo, and back photo and send your photos, your age, your profession, your city. Are you applying something, taking something for your hair growth? Are you suffering from a medical condition like diabetes, BP, allergies, this, that, and all? Are you taking some medications? You're vegetarian, non-vegetarian. Okay. Are you highly stressed, normal stress, or you're cool? So we need some information. Then, under our guidance, under our team's guidance, the doctor is going to tell you whether you are a candidate for hair transplant or not right now. You may not be fit for hair transplant, or you may be fit later for a hair transplant, or you don't need a transplant. You're too young for a transplant. You may be just having a thinning hair. So we will guide you free of cost because that's a duty. Okay.